Good day, mabuhay. Greetings of peace and joy. A Magus Day to all of us. I am Jethro Noel Daños, RN Man DM, a nurse by profession and currently working as an assistant professor of one of the higher education institutions in Cagayan de Oro City. I earned my doctoral degree of Doctor in Management, major in Advanced Healthcare Administration in Liceo de Cagayan University. My study is entitled Implementation of Flexible Learning Practices in Higher Education Institutions Offering Nursing Program. The main reason why I conducted this study during the pandemic is to see how the nursing profession adapted with the sudden change brought to us by the novel coronavirus, to measure the extent of tuning made in nursing program by the higher education institutions during the pandemic, which surely have created rippling effects in delivery of nursing education. It sought specifically to determine the relationship between the implementation of flexible learning practices and the learning approaches, technology literacy, preferred schedule, and innovative tools. It also determined the variable that best predicts the implementation of flexible learning practices. And lastly, to identify the best fit structural model for the study. The study adopted two influential theory, namely the social learning theory by Bandura and the cognitive theory of multimedia learning by Mayer. These two aided a lot in finalizing my conceptual framework. As you can see, these were the variables used in the study, showing how they interplayed from each other as my independent variable and dependent variable. Now for the methods, 233 participants were chosen during the process using the proportionate stratified random sampling. Descriptive statistics such as the mean, frequency, percentage, correlation, regression, and structural equation model were used to analyze the data. And lastly, of course, very important, the validity and reliability of the instruments. So first, of course, I need to have the CHED guidelines on flexible learning, which was implemented last October 2020 as my reference as I make my tool. Then I had also two experts validated my self-made questions before I conducted my pilot study composed of 30 student nurses. The results that fall below 0.30 reliability coefficients were automatically discarded. Then lastly, of course, I made exploratory factor analysis and confirmatory factor analysis. Now for the results and findings, our first objective was to determine the learning approaches utilized by the students. Here we use the mean and standard deviation as our statistical technique. The results revealed that among the indicators that fall under learning approaches, limited face-to-face hospital duty is highly utilized with a mean of 4.87 compared to other learning approaches under online and blended, which are the virtual duty and enhancement classes, and even limited face-to-face in-campus classes. For our second objective was to describe the technology literacy of the participants of the study. In terms of the technology literacy, the results showed that smartphone got the highest utilization with a mean of 4.26 among the variables under digital devices and interface as part of the technology literacy rather than using the desktop computer, tablet, email, and cloud computing. For our third objective, which was to identify the preferred schedule of the participants of the study, still using the mean and standard deviation. For the preferred online schedule in the aspect of duration of the time and frequency of days, more than an hour is the most utilized with a mean of 3.97 compared to less than an hour, 1 hour only, once a week meeting, twice a week meeting per subject for the online classes. And next, for our fourth objective, which was to determine the innovative tools used by the participants of the study, still we are using the statistical technique mean and standard deviation. The utilization of innovative tools, the results showed that the participants of the study make use of an open education resources rather than learning management system or LMS, and portable learning packets or your PLPs. While for our fifth objective, which was to assess the practices implemented in flexible learning by the higher education institutions, we are still using the mean and standard deviation. Out of 30 indicators, the strongest results showed that the participants is given reminders on health and safety protocols in accordance with the IATF and LGU advisories with a mean of 4.45. And the lowest indicator among 30 indicators was the student can utilize LMS, either proprietary or non-proprietary, with a mean of 3.73. Now for our sixth objective, which was to correlate practices implemented on flexible learning by healthcare professional courses and learning approaches, technology literacy, preferred schedule, and innovative tools. This time we are using Pearson product moment correlation as our statistical technique. When implementation and practices of flexible learning were correlated with other variables, the results showed that preferred schedule was not significantly related with flexible learning practices, while the learning approaches, technology literacy, and innovative tools were found to be significantly related with the implementation of flexible learning. Now for our seventh objective, which was to identify the best predictors of the practices implemented on flexible learning by higher education institution. This time we are using the multiple regression. The regression analysis explained that the learning approach, technology literacy, and innovative tools are the factor or variables that significantly influence in the implementation on practices of flexible learning in higher education institution. It has a beta weight of 0.403 for the innovative tools, 0.373 for learning approaches, and 0.309 for technology literacy, which are all significant at 0.001. Thus, the null hypothesis stating that there is no variable that best predicts the implementation of the flexible learning practices in higher education institutions was rejected. Now, for our eighth objective, which was to determine the structural model that best fits the practices implemented on flexible learning by higher education institutions. Here we are using the multivariate analysis, which was the structural equation model or SEM. Out of 13 attempts, I finally came up with the best fit higher education institution structural model, which was presented here. So as supported with the summary of the goodness of fit index. Now for my conclusions and recommendations of the study. First, for the conclusions, for higher education institutions, they were observed that they are utilizing and practicing flexible learning. And implementation of both online and blended learning were being observed, unless, of course, they need to have first the approval of the Commission of Higher Education to conduct such. And lastly, students' access to devices, smartphone is most used by the students as of now, both online, blended, and even face-to-face classes. While for my recommendations, for the higher education institutions, the top management of the universities and schools offering nursing program, and even the hospitals, the best practices should be shared, alignment should be conducted, platforms should be well communicated and updated with the affiliating hospitals and schools, and even the health and safety protocols should be strictly observed. While for the teachers and students, trainings and strategies, technology literacy, and innovative tools are strongly recommended to be having trainings, workshops, and even seminars so that we can ensure that both the teachers and students are equally updated. And lastly, of course, for our future researchers, other possible dimensions to be observed other than the variables used in this study and wider scope of participants were strongly recommended so that we can come up with better system and to ensure that we continually ensure quality nursing education in the future. As for the impact of my study, the ordinances and policies released by IATF, Department of Health, Commission of Higher Education during the pandemic made us more resilient individuals, thinking out of the box, in which the educators became more creative with their deliverables. The resistant of change became aggressive in adapting with the technological platform, and the students became appreciative of the importance of direct patient care for them to become an effective healthcare provider someday. I have learned a lot throughout the journey of complying my study, challenge my mental health, breakdown episodes, and from hesitating to adapt with change to embracing the change made by the pandemic and turning the disadvantages as my advantages to continually deliver quality nursing education. The beginning has always been the bitter phase, but the ending, always the sweetest one, which makes you to ask for more, the hunger of new discoveries and learnings. And now, finally, we reach the end of my presentation. To all the attendees, I appreciate your virtual presence and I hope that my study somehow gives you additional learnings that you can use someday. Thank you for listening. God bless us all.